Hey everyone, and welcome. If you're gearing up for your NHA phlebotomy certification, you are in the perfect spot. Today, we're going to break down a real strategy to help you not just take the exam, but to walk in there and pass it with total confidence.
So let's just get right to it. The question that's probably on your mind. What is the actual secret to passing this thing? I mean, is it just about reading the textbook cover to cover a dozen times? Is it about memorizing every single term? It can feel like a ton of pressure, but you know what? The answer is actually way simpler than you think.
The secret? It's all about studying smarter, not just harder. It's about having a real game plan. And in this explainer, that's exactly what we're going to give you. A strategic roadmap so you can focus your energy where it's going to have the biggest possible impact on your score, and more importantly, on your career. Okay, let's get into it.
So our very first step is to decode the exam blueprint. I want you to think of this as the official map to the test. Before you even think about diving into the content, you've got to understand the layout of what you're up against. You see, the NHA didn't just pull these questions out of thin air. The whole exam is designed to mirror what you'll actually be doing day to day as a phlebotomist. The different sections, or what they call domains, are weighted based on how important and how common those tasks are out in the real world. And this is great news for you because it means the blueprint is basically your ultimate cheat sheet for studying. Now take a look at this chart. This is so revealing because it lays out your priorities crystal clear. Routine blood collection, that's a massive 35% of the exam. That's your bread and butter. And right behind it, at 20%, is safety and compliance. You guys, together, that's more than half of your entire score. This right here tells you exactly where you need to spend the bulk of your study time. And this quote just hits the nail on the head. You can't just memorize these topics as separate little islands of information. The exam is going to test you on how it all connects. So a question about a routine blood draw might also bring in elements of patient prep and safety rules. You've got to be thinking about how all these pieces fit together in a real-life situation. Okay, so now that we get the structure, let's dive into the really important stuff, the core content. We're going to focus on what we call high-yield topics. These are the concepts and the procedures that are absolutely critical and are the most likely to show up on your exam. First up, the unbreakable rule, the order of draw. And let me be clear, this is not a suggestion. It's a fundamental standard that you have to know forwards, backwards, and in your sleep. Every tube has a specific additive, and if you draw them in the wrong order, you can get what's called additive carryover, which totally messes up the specimen and gives you bogus test results. You've got to know the color, the additive, and exactly why it's in that spot in the lineup. Just as critical, maybe even more so, is patient identification. The correct procedure is completely non-negotiable. You have to use at least 2 unique identifiers, think full name and date of birth, and you have to actively confirm them with the patient. And the consequences if you mess this up, they're huge. We're not just talking about a rejected sample. We are talking about the risk of serious harm to a patient from a wrong diagnosis or the wrong treatment. Now, beyond those 2 big ones, there are a few other high-yield areas you have to master. You absolutely need to know why a lab would reject a specimen. Things like hemolysis or if it's labeled wrong. You have to understand OSHA's safety standards, especially when it comes to your personal protective equipment or PPE. And you should definitely be ready for questions about the super strict sterile technique for blood cultures and the quality control steps for point-of-care testing. And let me just hammer this point home with a direct alert. Do not underestimate safety and compliance. It's not just a small section. It's a primary scoring domain. The exam is going to put you in situations where you have to make the safe and compliant choice every single time. No exceptions. Okay, so we've talked a lot about what you need to study. Now let's switch gears and talk about how you should study. Because just rereading your notes over and over again, it's actually one of the least effective ways to prepare. We need to use strategies that are actually backed by science. The first and honestly the most powerful strategy is something called active recall. So instead of just passively letting information wash over you when you read, active recall is the process of actively pulling that information out of your own brain. Every single time you force yourself to remember something, you're making that memory stronger and way easier to find when you're under pressure in the exam room. And this slide shows the difference so perfectly. On the left, you've got passive reading, highlighting, just kind of scanning your notes again. It feels like you're being productive, but you're really not. On the right, that's active recall, try the cover write check method for the order of draw. Cover up the list, try to write it out purely from memory, and then check how you did. That simple act of testing yourself is what builds rock-solid, reliable knowledge.
The second amazing strategy is spaced repetition. You know how our brains just naturally forget things over time? Well, spaced repetition is how you fight back against that forgetting curve. You basically review information at intervals that get longer and longer over time. Just like this timeline shows, you review new stuff pretty soon after you learn it, and then you gradually stretch out the time between reviews. This process tells your brain, hey, this stuff is important, and it moves it into your long-term memory.
So here's the key takeaway, the big point of this section. When you combine these two techniques, active recall and spaced repetition, you get the most effective, highest yield study system there is. It's the secret sauce. Use things like flashcards or practice quizzes for active recall, and then review them on a spaced repetition schedule. This is how you walk into that exam feeling truly prepared, not just like you crammed the night before.
All right, so the absolute best way to practice active recall is by doing practice questions. They are so essential because they force you to actually apply what you've learned. They show you exactly where your weak spots are, and they get you used to the format and the pacing of the real exam. And here is a super simple but really powerful way to attack every single question you see. First, read the whole question and all the answers carefully. Keep an eye out for keywords like first or best. Step 2, immediately get rid of any answers that you know are just plain wrong. Then, with the choices you have left, compare them to the official CLSI or OSHA standards you've been studying. And finally, you have to select the best possible answer, because sometimes more than one option might sound kind of right. And you should expect to see questions from every single category we've talked about. As this table shows, you'll get scenarios about using PPE, about patient ID, about collection techniques like the order of draw, and how to handle special collections like blood cultures. Doing lots of practice questions will make sure you're ready for anything they throw at you. Now, once you're feeling good about individual questions, it's time for the final dress rehearsal, full-on case reviews and mock exams. These are your final training ground. They don't just test one little fact. They test your ability to pull together knowledge from all the different areas to make a safe and smart decision when the pressure is on, which is exactly what the real job and the real exam is all about. We've made it to our final and, I would argue, our most important section, avoiding the mistakes that can cost you the whole exam. Knowing what not to do is every bit as important as knowing what you should do. So let's start with what we call common pitfalls. These are those frustrating little mistakes that can just chip away at your score. Things like reading a question too fast and missing a key word, or overthinking a simple question and talking yourself out of the right answer, or, of course, just running out of time. You've got to be methodical, trust all the prep you've done, and really pace yourself. But there are some mistakes that are in a whole different league. They aren't just little pitfalls that might cost you a point. They are critical errors. These are actions that violate the most fundamental rules of patient safety, and on the exam, they are basically considered automatic fail situations. I really want you to take a hard look at this table. These are the absolute nevers of phlebotomy. Failing to properly identify a patient, recapping a used needle with 2 hands, trying to relabel a specimen after you've already walked away from the patient. These actions have severe, real-world consequences, from horrible needle stick injuries to catastrophic harm for a patient. Choosing one of these answers on the exam shows a complete misunderstanding of your most important job, protecting your patients. And this right here, this quote, brings it all together. This is your guiding star. If you are ever in doubt on an exam question, just ask yourself this. Which of these options puts patient safety and the official rules above everything else? That will almost always lead you to the correct answer. Convenience or trying to be fast never, ever wins out over safety. You know, when it comes down to it, preparing for this exam isn't really just about passing a test. It's about preparing yourself to be a competent, safe, and trustworthy healthcare professional. So the final question is, are you ready to take all this knowledge and start practicing like one? You've got the tools, you've got the strategy. Now go out there and earn that certification. You've got this.